Congratulations. If you're watching this set of videos, you've decided on getting a penile implant. The reason I've recommended this surgery to you and this treatment for erectile dysfunction is because it's perhaps the most permanent, reliable, and freedom-providing treatment for erectile dysfunction. So you've made it to the day of surgery. When you come into the surgery center, you're going to be welcomed by my staff. You're going to meet your nurse who's going to be taking care of you. And perhaps we're going to start some antibiotics before we go to the surgery. When you get to the operating room, you'd be comfortably put to sleep by our anesthesiologist. And before you know it, the surgery is going to be over, so I'm going to tell you a little bit about it. It takes me approximately 30 minutes to 1 hour, as you may have seen in a former video. During this time, I make a small incision either above the penis or between the penis and the scrotum. You're obviously not going to be awake for this, so you're not going to know any of this, but this takes me on average about 30 minutes to 1 hour. And before you know it, you'll be recovering in our recovery room back with your nurse, and you'll be getting ready to go home after the surgery. For most patients, this is an outpatient surgery, meaning you go home the very same day. After the surgery, you'll recover for approximately an hour or 2 hours in the recovery room, and you will need a ride to take you home. In our preoperative visit, we will have discussed all the approvals that you need prior to surgery. You will need to meet with one of the anesthesiology staff members in order to clear you for surgery and to have a listen to your heart and lungs. If you've got certain heart or lung conditions, I may have asked to get approval from your cardiologist or a particular doctor taking care of you. It is absolutely 100% true that you will need to arrange for transportation after this surgery. I'll remind you that this is an outpatient surgery, so you will go home just a few hours after your surgery. Prior to surgery, I will have you start using an antibiotic soap called Hibiclens. You will use that the day before surgery as well as the morning of surgery. This is done because it helps us reduce the risk of infection. Now, if the insert on the soap says do not use on the genitals, please ignore that. It is completely safe to use around the genitalia, and I really do want you to focus in the genital area. Now, for the most part, I'll ask you to continue all of your medications. Before your surgery, you'll have met with me or one of the other doctors. The main exceptions to continue your medications are really blood thinners. So if you're on aspirin, Plavix, or Coumadin, as well as some of the newer ones called Xarelto, we would have discussed this beforehand, and I will have perhaps asked you to discontinue this medication as well. Do not eat or drink anything after midnight the night before your surgery. There really aren't too many things that I ask you to bring to surgery. I do want you to bring your license, your insurance card, and I do want you to bring some loose-fitting pants, as well as some tight-fitting underwear if you've got some at home. If you do have sleep apnea, I may have asked you to bring your sleep apnea machine as well. I do ask that you avoid any shaving in the genital area before your surgery. When you get to the surgery center, you'll be taken to the preoperative area where you'll meet your nurse. The nurse will ask you to change into a gown and perhaps start an IV on you. You'll be started on some antibiotics that'll help us reduce any risk of infection. During this period, you'll then meet the anesthesiologist who'll go over all the anesthesia component of your surgery. Of course, I'll be right there and I'll be with you the whole time, and we'll talk about everything all over again before your surgery. I know that this process can be really overwhelming when you're having a surgery, but I want you to know that you're going to be in really good hands, and we will take really, really good care of you. You know, it's completely normal to feel nervous before a surgery. We've all been there, we've all done it. And I want you to know that you're not alone in this process, and it is completely normal to feel this way. But I want you to know that we'll take really good care of you, and you'll be with some of the best folks that I work with. The simple answer is call my office anytime. Before the surgery, I will have given you the entire packet that includes all the numbers to call. If it's during business hours, you'll call the main line and someone from my team will get back to you. If it's after hours and if it's really urgent, I would urge you to call the on-call urologist who's available to talk to you at any point.